outcome about 4 or 5 months ago. I saw her today and I was like, oh, it's improved. She's really pretty. She's always been pretty. I see some scars, but not that many. I was like, let me pull up the originals. I was like, wow, I did not realize the difference that the silicone microdroplet combined with our rebirth procedure made. She did pro-fractional, she did contour, microneedling, radiofrequency, and the silicone microdroplet. Were you nervous when I told you to do silicone?
No.
Originally?
Oh, originally a bit. That
Just
was
looked
like,
into
I'd
it.
say out of everything, that was like the one I was a bit more
Scared.
nervous for.
Because people have like a weird connotation to it because they think large volume, messing up people's faces. That's when people are using usually sort of illegal and very high volumes. Look, I'm doing this technique where we're literally just sculpting the surface, and this is where you go right into the surface of the scar. It almost embeds directly into the surface, so you don't have bumps. That's what we were just talking about. You can get them if a person doesn't know how to inject or where to inject. The other thing is some of her scars had some depth to it, so usually what we have to do in those cases is do a little bit subdermal, and it's so little the amount that we do that it does not affect contour, but it is really critical in getting an overall improvement, which is why I just did the surface, and now I literally do these, and this is probably all she'll need, which are these, maybe 2 sessions. I'll show you guys the before. Jason, do you have that? Did you take a picture on that phone, your phone? Grab that really quickly so I can show them her original, or the difference between the 2 sides. So basically what I was doing is going over under some of the areas. So let's pull that up. Zoom in a little bit on the before one for me. Like zoom in on it. And bring that over. So look at you guys. Look, come out just a little bit more. Come out. No, Jason, pull the photo out. There you go. There. Show that to them. So look at you guys. Look how deep those scars were. Now look, okay? Look at this. Literally nothing. That right here was that big thing right there. And that's what I'm working on right now. I'm going right into that surface of that area and just sort of treating it. This is the power that microdrop of silicone can have when it's done correctly in the right hands. And so, like I said, very minimal. I'm doing a little bit of that scaffolding technique, but not much. Hold right here for me now with your left hand. Let's go to the other side, show them how it looks. If there's any questions, Linz, let me know.
Yeah.
What do people ask you, Lindsay, when it comes? Because you're one of our coordinators, and you're always talking to people and telling them, no, this is not that silicone. This is not. You're okay. Turn this way. There you go. Turn a little more. There.
Like, is it going to be lumpy or bumpy? And what happens if there's too much? And how can I make it look natural? And that is not something that they're worried about, is having to make it look natural. That's what your technique is.
So that's the thing. So how do you reassure them?
I reassure them by saying that, showing them the videos and letting them know it's little tiny bits right into the scar themselves. And so it's just plumping it out. It's becoming part of your skin, and it's going to be unnoticeable. And it's a long-term investment that you
this is going to be your permanent change. And so you guys know, I've been doing this for a very long time. This is not how we originally did the treatment, but it's progressed. This is the progression of medicine. And so what I'm doing now on this side too is I went to those superficial levels. Now we go just right below and give a little bit of, this is more of a collagen scaffolding. Plus she had a really deep scar that was here before, and so I want to make sure that don't come back. Other than that, I mean, she's probably not going to need these deeper treatments. Can she do, or in terms of the silicone, can she do lasers more? Yes, we can keep doing lasers until she's satisfied. My goal is that the majority of improvement is these first 2, which is now going to be our second treatment. And we're going to be doing Halo with our deep pro-fractional today. And I think she'll get really, really good outcome. You guys can see here, I mean, literally, as I press like this, look.
It's so smooth.
It's literally, there's nothing, okay? That's the goal. I want her to, girl, if you're getting ready for a wedding, if you're getting ready for an event, you want to, look your best. Basically, that's what we're trying to do. And so getting you ready for just self-confidence for yourself. When this hormonal outbreaks occur, sometimes they can be really damaging, not only to the skin, but also to your life. So that's it. Let me show you the other side now that we've finished. Let me grab a little alcohol. Jason's been cleaning. I know, he's doing great. Turn a little bit this way. So now I take a look and I see, wow. Okay, so now let me pull back. Grab me one more time, Jason, that before. You have it? grab me the picture so I can show them now that it's dry. I want to see if there's another image that doesn't have the light on it. Yeah, there. Go back, right there. I'll grab it. I'll show them. I won't look, don't worry. Okay, so now look. So here's where we are before, okay? You see it? Now look. Wow.
Yeah.
So we've really addressed that deep indentation. So if I were to go like this, let's say like that, that's her face.
It's
That
gone.
deep indentation is gone. And the majority of them, look at some of these. So we got to do a little bit more over here, a little bit more over there. But other than that, I think I'm really happy with this. Even that one over here, there was a big one. Look at that right
Yeah.
there. Let's do it again. Go like show exactly where it was. Placements right here. Wow. Significant, you guys. Do not let people fool you. Go to the best for your face. That's it. I'm gonna keep going. I'm just gonna do a little bit. Huh? It's fine. No, it's